Today we are going to discuss about the humerus. Humerus, it is present in the arm. So it is called by the brachial bone or arm bone. This humerus, it has three parts. It is divided into the three parts for the description purpose. This is upper end and lower end. In between the upper end and lower end, and there is a soft is there. This is the soft. So this upper end, it has so many parts. The head of the humerus and the lesser tubercle or anterior tubercle of the humerus and the greater tubercle of the humerus. In between the lesser tubercle and the greater tubercle, and there is a intertubercular sulcus. Intertubercular sulcus, head of the humerus, greater tubercle and lesser tubercle. These things are present in the upper end. And in the soft, it is a very strong bone. It is present in between the upper end and lower end. In the lower end, and there is a inferiorly projected bony part. This is called by the medial cantle, and laterally, and there is a lateral cantle. Medial cantle is very prominent. It is projected from the lower end of the humerus, and it is called by the medial cantle. And lateral side, it is projected downwards, and it is a very prominent in the lateral side. And this medial and lateral candidates, they comes under the lower end. And here, and there is this capitulum is there. So this capitulum and this one is a trochlea. It is a fully shaped. The capitulum, it articulates with the head of the radius. And this fully, when the trochlea, it articulates with the Olapnan process of the ulna. So here, first we have to discuss about the side determination. The head is projected upwards, slightly backwards and medially. And here there is a elevated bony part, and this is called by the lesser tubercle. And laterally, and there is a greater tubercle is there, and it is a prominence. It gives the prominence to the shoulder joint and the shoulders, and this is a lesser tubercle. Lesser tubercle is placed in the lateral side. Anterior tubercle, it is placed in the anteriorly, and it is projected medially, forwards, slightly backwards and upwards. And in the inferiorly, in the lower end, and in the posterior surface, in the posterior side, there is a Olapnan fossa is there. So this Olapnan fossa, it is placed in the lower end, in the back side. And in the lower end and the lateral side, and there is a radial fossa is there, and here there is a Olapnan fossa is there. It is a ulnar fossa, and here there is a radial fossa is there in the lower end. So what I have to say, and in the side determination, anteriorly, and there is a anterior tubercle. Lateral side, there is a lateral tubercle, and the head is projected slightly medially, backwards and upwards. And anteriorly in the lower end, there is a radial fossa, and ulnar fossa is there. This has to present in the anterior side. In the back side, there is a Olapnan fossa is there. So, and this belongs to the left side humor. Suppose if you bring this in the right side, so this Olapnan fossa, it has to present in the back side, and it is coming towards the front side. And then there is this radial fossa and ulnar fossa, and they are going towards the back side, meaning it is not belongs to the right side humerus. And this anterior tubercle, it is going back side. It has to present in the anteriorly, so it is not a right side bone, and it is a left humerus. So first we have to discuss about the one by one, and this upper end, and then we discuss about the shaft, and then we discuss about the lower end, about their features, and the lastly, and along with this, and we shall discuss about the attachment and the humerus. So first the humerus. This is the scapula, and it is a glenoid cavity, and it is a proper process. It is a head of the humerus, and this one is a anatomical neck of the humerus. It is a greater tubercle, and it is a shaft of the humerus. It is a shaft of the humerus. So here, this side here there is a lesser tubercle is there. This one is a anterior tubercle of the humerus, and this one is a greater tubercle of the humerus. You see here, and this one is a anterior tubercle, and it is projected and just below the neck of the humerus. So, and neck of the humerus. Below the neck of the humerus, and there is a elevated part. This is called by the anterior tubercle. Anterior tubercle or lesser tubercle, it is placed in the anterior side, and this one is a greater tubercle. So this greater tubercle, and it has an anterior border and lateral surface and superior surface, and this one is a superior surface, and here there is a faint posterior border is there. And this one a fainted posterior border, and it has a lateral surface, and slightly there is an anterior surface, and there is a prominent anterior border is there, and superiorly there is a superior surface is there. So superior surface, it receives the superior surface. It receives some muscles attachment, and the lateral surface, it gives the prominence to the shoulders. It gives the prominence to the shoulders, and this one is a anterior border. And the lesser tubercle, it is placed anteriorly, and it is separated by the intertubercular sulcus. So this anterior border, anterior tubercle, it is the inferiorly, and there is some margin is there, and this margin it stand for the medial border of the intertubercular sulcus. The anterior border of the greater tubercle and anterior border, and it descends downwards inferiorly, and it forms the lateral boundary or lateral border of the intertubercular sulcus. The head of the humerus. So head of the humerus, its a diameter is more than the glenoid cavity. If you compare the articular surface of the glenoid cavity of the scapula, and this glenoid cavity of the scapula, its diameter lesser than this head of the humerus. Head of the humerus, articular surface, and its diameter more than the glenoid cavity. So what happens? And when there is a negative force act on this humerus, and if it is from the superior side, and otherwise there is a fully abducted arms, what happens? And it is coming like this, and at this reason, and there is no bony support. And if you go superiorly, here there is a common process is there, and if you are coming towards the anterior side, and there is this one coracoid process is there, and here there is a coracoacromial arch is there in between. The coracoacromial arch, it is present in between the coracoid process and acromial process. It prevents the upward dislocation of the head of the humerus. But inferior dislocation is very common, and in a volleyball players. In the volleyball players, and when there is a fully abduction of the arms, and leads to what happens, and if he is pushing the ball powerfully, and there is a chance to dislocate the humerus in the inferior side, and that is mainly the drawback of there is a inferior dislocation of the head of the humerus. So head of the humerus, the diameter is more than the glenad cavity, and then superiorly there is a bony support is there. One is acromial process, another one is a coracoid process, and in between that and there is a coracoacromial arch is there, coracoacromial ligament is there, and there is a superior dislocation it is not possible, and this inferior dislocation is possible, and when it's during this playing of the volleyball, in the volleyball players, and in a abducted arms and upward abduction, overhead abduction. In this case, what happens, and this head of the humerus and it dislocates inferiorly. And then there is regarding about this neck of the humerus. The neck of the humerus, and here you see, and this one is a neck of the humerus, this is a greater tubercle, and this one is a anatomical neck of the humerus. This is the anatomical